Chlamydia is the #1 sexually transmitted infection in the world. There are several species of chlamydia that exist, but when we talk about the most common STI that is responsible for the disease chlamydia, we're talking about Chlamydia trachomatis. Chlamydia can be transferred from one person to another. Sex is the most common way. That includes oral sex, vaginal sex, and anal sex. Chlamydia can be transferred also with childbirth and direct contact. For example, something like scratching or touching another part of the body like the eye. For example, this is a female infected by a male. So here's the chlamydia, and it's making its way into the vagina, and it will multiply to spread further into the cervix. And since the chlamydia is nearby, it could travel its way up to the urethra. When this happens, a lot of white blood cells that come from the bloodstream to the genital or the urinary tract to attack the infected epithelial cells. So when this happens, the white blood cells come from the bloodstream to the genital or the urinary tract to attack the infected cells or any chlamydia they can eat up that's outside of the cells at the time. Then comes along inflammation, which brings swelling, pain, and burning. The burning sensation you have when you pee is called dysuria. When the infection is in the vagina, it's called vaginitis. Now if the chlamydia spreads further to the cervix, it becomes cervicitis. Just like how there's a term for painful urination, dysuria, there's also a term for painful sex or intercourse called dyspareunia. Now for the males, if the chlamydia enters through the urethra, also they're going to have urethritis. And if the chlamydia continues and reaches the prostate, you'll end up with prostatitis. Now the difference between the male and the female is that the female has an opening from the uterus to the abdominal cavity. So if the chlamydia passes through the cervix, through the uterus, through the fallopian tubes, it can actually spread and seed in the abdominal cavity. So as I said before, chlamydia can be spread by direct contact. For example, if someone touches puss with their hands and they rub their eye later on, they just directly spread chlamydia into their eye. By the way, the eye is looking downward, so later on you'll start to see bumps in the inside of the eyelid. These bumps on the eye will start scratching and it will cause irritation. The conjunctiva, which is the area right here, which is not infected, will now be referred to as conjunctivitis. Irritation will start in the white of the eye, which will spread the infection to the pupil, which is called opacity. This is what makes it very hard to see, and this is what's referred to as trachoma. Another site that can be affected from the bloodstream are your joints. So this knee right here can be infected, referred to as ineffective arthritis. There will be a lot of pain and difficulty moving because a lot of white blood cells are here. The term for the painful joints is dysarthria. How to prevent chlamydia? Use a condom, use a dam, and no sharing sex toys. If you have any questions on chlamydia, please visit womenshealth.gov.
Am I at risk for chlamydia? How do I know I have chlamydia? I was treated for chlamydia. When can I have sex again? Or if I'm pregnant, how does chlamydia affect my baby? Well, I am here to answer all those questions. The answer to this question is simple. As my partner said, anyone who has sex can get chlamydia through unprotected vaginal, anal, or oral sex. However, sexually active young people are at higher risk of getting chlamydia. You can reduce the risk of getting chlamydia by using a condom the right way every time you have sex. Most people who have chlamydia have no symptoms. If you do have symptoms, they may not appear until several weeks after you have sex with an infected partner. Women with symptoms may notice an abnormal vaginal discharge or a burning sensation while urinating. Symptoms in men can include a burning sensation while urinating, and pain and swelling in one or both testicles. If your doctor prescribes a single dose of medication, you should wait 7 days after taking the medication before having sex again. But if your doctor prescribes a medicine for you to take for 7 days, you should wait until you have taken all of the doses before having sex. So you should not have sex again until you and your sex partner have completed the treatment. If you are pregnant and have chlamydia, you can pass the infection to your baby during delivery. This can cause an eye infection in your newborn. Having chlamydia may also make it more likely to deliver your baby too early. So now that you're a little bit more informed on this STD and its dangers, you should be more careful with who you're having sexual relations with.